If you've been here watching our video, you've met Olivia. Today, you are going to meet a friend and one of the nurses she works right beside every shift. Her name is Riley. She's a nurse on our oncology floor. She's fairly new to nursing, and she's a fantastic and fabulous nurse. She made a big move to get here, leaving a much bigger city in Ohio for something completely different. New career, new city, new life, and one of the hardest floor in the hospital. I wanted to sit down with her to hear what that experience, what it's been like for her. So Riley, thank you for being here today.
Thank you for bringing me.
Absolutely. Tell us who you are and where you work.
Well, I'm Riley Ruff. I work at a local hospital at the Treasure Coast. And I just had my 25th birthday, I guess. I mean, I'm an open book, so just go away.
All right. So now tell us how long you've been a nurse.
Okay, so I had my license for 2 years, but actually working as a nurse, my 2 years will be in September of this year. So almost 2 years.
So how long you've been working in oncology? Was this something where you're thinking about oncology? How did you?
So I've always been in oncology, even as a tech. So I was always interested in oncology. And that was like my bread and butter. Felt like a passion, like a drive to be in oncology. So being a tech in oncology made me want to be in oncology as a nurse.
So you started basically uh, your career, your nursing in oncology in Ohio. Is that right?
Yes.
So tell us about that.
So I'm from Columbus, Ohio.
Mm-hmm.
That's where I went to nursing school as well. I worked in Columbus and a float pool at a cancer hospital. That hospital had 21 floors.
Wow.
So yeah, I would be like, whether it's like medical ICU, SICU, oncology emergency room. It was like a very specialized hospital for oncology patients. So I did that for a couple of years while I was in nursing school.
So you were a tech.
Hmm.
So I want to go back. So starting as a tech
Hmm.
and finding yourself in oncology.
Hmm.
So I would just want to work. I want to know exactly how, from a tech, how did you get
In
into
oncology.
Yeah.
So I've had some family members that had cancer.
Okay.
On my dad's side, I had a great grandmother
I see.
who we were close with that had ovarian cancer. And that drove me a little bit like more interested in people with cancer,
Yeah.
especially there's such a rise with people getting
That's
cancer.
right. Yeah.
And then my grandmother,
Wow.
I don't remember what type she has, but it's a leukemia. It's terminal.
Mm-hmm.
She was diagnosed with that as well. But slow progression, she's fine. So with those experiences, it made me into oncology. Now to be a nurse, that's a different story.
Yeah. Yeah. Wow. So actually, you see your loved one going through that,
Yes.
and starting as a tech. Now you are a nurse.
Yes.
That is so. That is so. I mean, unfortunately, someone with cancer, right? This is tough. Having your family going through that.
Mm-hmm.
Now you are at the bedside,
Yes.
taking care of those patients.
Yes.
That is. So you do have that in you because you saw your family went through it, and you want to make that difference.
Right.
So I want to go back to, you knew that you wanted to be in oncology because you want to be that person. Maybe you saw a nurse taking care of your loved one, and you know what? I want to be a nurse as well, taking care of other people.
Right.
Now, it took a long time for you to become a nurse, nursing school, prereqs and everything. So walk us through, and in Ohio, nursing school.
Yes.
Give me a little bit of like how was nursing school for you?
So the school I went to, it was a big college. Very competitive for nursing in that
course.
college. And I was fortunate enough to get accepted the first time I applied.
Wow, nice.
And this program, I didn't become an LPN first. I went straight for my RN BSN. So I was doing that for 4 years straight. So that's how I got into like the bigger hospitals in Columbus, because we would have clinicals in those types of hospitals. So that's how I got my job being a tech, and how I found like oncology is like, yeah, I want to be that as a nurse.
So now one of the things that I want to touch on. So you came from bigger hospital, bigger city. So now you come. So I want to talk about that transition from a bigger city to a smaller city, from a bigger hospital to a smaller hospital.
Yeah.
Talk about that for a little bit.
Well, I definitely don't miss the traffic. Yeah, no, the bigger hospital is like you're trying to find a shuttle bus to even go to the hospital. You got to pay for parking. Like there's garages that you could pay parking passes to come out of your paycheck. Wow. Yeah. Now, it was, I think moving just from Ohio to Florida, that was a big change. Like I lived 1,000 miles away.
Wow.
And I drove down here. But I had this job. Like I had applied and did like a virtual like hiring up in Ohio. So I had this job before I even moved down here. So I did like a relocation basically. But yeah, I think the drive down here, coming to a smaller hospital, definitely a big change. Some of the changes, I love the parking. You don't have to pay for that. But I think it's the biggest change is there's not as much resources, meaning like technology wise, that I had to get used to. Some of the codes are different from Ohio to Florida itself. So there was a lot of changes. Yeah. But I feel like working at a small hospital, in my opinion, is better. Just because, like for me, because I actually felt like I knew the people I worked with. Yeah. Working at a bigger hospital and being in the float pool there, I was like, didn't know really much of who I was working with. So, yeah. And you form some like bonds with the people and you get close to them. So, yeah.
So you've been here for how long now?
I moved down here September 2024.
Okay. So new city, smaller hospital, new hospital. Yep. New environment. And how are you adjusting? I know now you are in Florida. Yeah. Yes. So hot. Yes. So like anything like you can compare in terms of like different cities, like, yes, of course you mentioned the traffic. Now you are in Florida.
In a smaller city.
In a smaller city.
I like it a lot. When I hear people complain about the traffic because, construction, I'm like, oh, this is nothing. This is like nothing. But no, like, I don't know. I just like the feeling. I thought at first it would be hard to adjust just because that's where I grew up. Yeah. Like, I've never moved out of state. And that was a big change.
So I want to touch on when you started nursing. How was that the first day? You got your license. How was that the first day on the floor as a nurse? What was it
like on my own?
On your own, yes.
It was nerve-wracking, of course. Yeah. I mean, we had a lot of training since I was a new grad, so I had longer orientation than like experienced nurses would. But I knew the people that I had that shift with, and I had resources if I had any questions. And honestly, the more you work and use your resources provided to you, it made me more comfortable. But no, it definitely takes some time to get used to being at the bedside as a nurse, because you're thinking, okay, I'm not a tech anymore. Yeah. I'm a nurse responsible for these patients.
That's right.
I have more responsible, sorry, for their assessment, any decline. Like I have to notice anything because we're at the bedside. The doctor isn't. And the doctor doesn't know the patient will change unless we tell them. So that's what's running through my mind. Like I have to, like this is my my game.
Do you think you had to change? So when you start as a tech,
Yes.
and then you now a nurse, did you have to switch that mindset of from a tech to a nurse? Now you have to think of your skills and quickly think about what's happening to the patient. Did you have to? How do you flip that? Because I've heard, I've seen that. Like, how do you flip from a tech to a nurse? And I want to know a little bit about that because not every nurse who started as a tech or as an LPN, and then now you were on the floor, you were on the floor as a tech. Now, how do you switch the mindset?
So I actually feel like, and I feel like this, if it doesn't answer your question, let me know. But I feel like me working as a tech actually helped me be a better nurse. Like with experience with the patients, like I didn't have to go through being worried to even go in my patient's room. Like I wasn't afraid of that. I think what I had to switch is I'm responsible. I'm the one responsible for the patient's life.
Yeah.
I'm responsible to notice any changes in my patient. Whereas a tech, like, oh, if the patient has a fever, I gotta let the nurse know. Like that's what had to be like that little flip.
Right. So it's fascinating because as a tech, you are the one reporting to the nurses the vitals, anything wrong with the vitals. And then you have to make the judgment what to do next.
Right.
Do I call the doctor, let him know, whatever? And then now you become a nurse. The tech it was reporting to you now. So there is a leadership role
Right.
as a nurse, and you have to delegate the task now to your tech. How important it is to work with a wonderful tech. I mean, I don't think the techs they get enough credit.
Oh no, they don't.
It's like, how do you? I mean, from your own perspective, when you're working with the tech, how does that play in your shift? I mean, I want to know about that. Like, have a good tech. When you have a tech that that what, it's gonna be a good shift.
Yeah. No, you need to have a good relationship with your CNAs and also respect them, whether they're called CNAs, PCTs. I know they're called different hospitals. But if you don't have a good relationship with your techs, you're essentially not really doing good by your patient. And that's because if your techs can't even talk to you, how do you know there's any changes? But no, the techs, they help us so we're able to focus on the things that we are responsible for. Like they help them take the vitals, take them to the bathroom when we can't, if we have to do something else. Like they do deserve, like you said, a lot more credit. But no, I think developing a good relationship with them and also knowing like we're not, because I feel like I've seen some conversations or topics even on social media, like techs feel like they don't get enough credit for what they do. So I think they deserve a lot of credit and to recognize them for that.
So, if you are a tech, a PCT, or CNA, HHA, different.
Right, there's so many abbreviations for them.
Yes, I want to make sure that you guys get a lot of the credits you guys deserve. You guys should be celebrated because you guys are the. How can I say that? Yes, the nurses, we are basically thinking, quickly think about the patient, but the techs, they are the eyes because they're there. The patient calls, they go in there and answer the lights. And if there's anything, they report it to us. So I want to make sure that we, the techs, PCTs, whoever you are, if you are a nursing assistant, you deserve all of the credits. Just know that how important your role is in our job, in our patients. So I don't know, even though, I'm not, it's not talk bad about the hospital or anything like that or whatever, because I feel like, our techs, our PCTs, our CNA, they deserve a lot of credits because that job, it is so important. Now, I want to touch on one thing, or I don't know, you can tell me one thing that nursing school did not prepare you for when you first started.
Okay, so I think anyone that went through nursing school and became a nurse could probably agree with me on some of the things. Nursing school prepares you to pass the NCLEX, how to take the exam,
100%.
how to answer the questions. And I mean, I'm not saying that they don't teach you nursing stuff, but what they don't is how it is actually being in the hospital. Talking about like nursing staff. I feel like that's something that's going on everywhere in the country and throughout the world. Working with people that are difficult, because unfortunately there are some people that may be a little harder to work with, like how you go about that. Those are some of the things like nursing school doesn't. It's like, oh, this is how you take the NCLEX, and some of the things you don't find out until you start working.
That is so true.
Yeah.
I remember when I started my nursing career, I started as an LPN. Oh my God. I started as an LPN. My first job was working in a nursing home. I loved it. Got the experience. I had about over 20 patients, peg tube, trachs. I think I had probably like 3 or 4 patients with peg tube, 1 or 2 with trachs, and you have to, crush pills and everything. It was my first day in that nursing home was, I can say it was hell because you had that many patients, trachs, peg tubes, and other patients that basically you have to do wound care. I questioned myself whether I should go back the next day because it was so, so, so hard. Now, for any new nurses who are out there who will start the career the first day, any advice for them?
Give yourself grace, honestly, because any field that you go into will be difficult, whether it's oncology, cardiology, orthopedics, labor and delivery, ICU, any type. Give yourself grace. And honestly, you'll get better with time management.
Yeah.
Use your resources, use your preceptors. They're there to guide you. And if you don't even feel like you have that good of a relationship with a preceptor, tell the nurse manager. Because if you're too afraid to speak up, they won't know. But yeah, honestly, I mean, I get that feeling. We were all new grads at some point. It's just something like, it'll take time to realize like, oh, okay, I got this. But also focus on some self-care.
Self-care.
Because if you don't, you will get burned out. You have to have some self-care in order for you to do your job.
This is such a very hot topic.
Mm-hmm.
The burnout.
Yep.
So how do you, 3 shifts, how do you self-care? I want to like for us to explore that a bit more. Self-care to avoid burnout. How someone who say, okay, well, I'm somebody who's a new nurse, right? They're juggling through, okay, they're trying to get their time management right,
Mm-hmm.
right? And trying to decide, okay, who do I go see first, in the normal shift, in the first shift on their own. So let's talk about burnout, self-care. I want a bit more about that. For new nurses, like what did you do to avoid that, like burnout? Was there anything else, like, self-care? I want to know more about that.
I focus on my hobbies that I like doing. So I love to read.
That's good.
I love to read. So anytime I have reading,
That's good.
I'll read. Like sometimes I'll take time and I just don't want to be interrupted with reading.
Mhm.
So my husband Tyler knows if I'm reading, oh, that's her time. Or even just like going to the beach, like doing something that you love. Because if you don't do those things on your days off,
Mhm.
you're you're not doing something for yourself. Whether that's getting your nails done, hair done, knitting. I don't even know any other hobbies, but
yeah.
like
That is so important because it's like, how do we? I think what I'm hearing is like, how do you have to disconnect?
yes, you do. You have to leave work at work. And that's something that I struggle with sometimes still to this day, but I'm getting better at it.
Mhm.
But if you don't leave work at work, you will get burned out faster.
Yeah. Because as nurses, we think about as a long shift, especially if we had a shift where like a lot of thing happens in that shift and we trying to replay that in our heads. The question is, we struggle. I mean, I do struggle. It's like, how do we disconnect? I think this is so important. If you don't, you're gonna take work to home, and next thing you know, you had bad shift. It start basically like spilling over like your loved one, your home, and everything, right? So basically, a nurse, you after your shift, disconnect, take care of yourself, do whatever you love to do. Try to leave work at work and then focus on yourself, because I think that there's a few very good things, because when you disconnect, right, from work, you do what you love to do. It gives you energy. It gives you, like some type of, makes you happy. And then the next day, you feel like refreshed. In my opinion, you feel refreshed, and then so that way you can, when you go back to work, so that way you're ready to go. Because a lot of times we struggle with that. I mean, nurses, because if you had a bad shift, you question, oh my gosh, I'm going back to work again. But again, nursing is so tough. But I think this is key. We have to disconnect.
Right. And that will take time. You have to learn to do that. Like I said, I'm doing that still sometimes. Like, oh, did I forget to do this? Or, oh, maybe I should, like, no, like, leave it at work. Like, you did your best. You took care of your patients. You, if you feel like you had a bad day, don't ponder on it. Everyone has bad days at work, whether it's just because the patient load. You just try to leave it at work, and that will come with time.
So oncology is tough, and I think I mentioned it's a lot of emotions.
It is.
And you see those clients that the patient will come with, coming for something else, and then they have another thing going on, and they get the news, and here you are with you are the nurse. How do you help them go through that?
I think about, honestly, because I've had some experiences, not even just with, because like I had lost my dad. I thought about that experience when I lost him, because I was a teenager and he had passed away in the hospital. And I remember how that nurse showed so much empathy and compassion towards me and my sisters. And I want to I want to be like, I want to do that. So focusing on my skills with empathy, and just trying to put yourself, like really put yourself in those shoes. Like, you can't say, oh, it'll be okay. Well, because it's not.
It's not.
It's just being there for them.
Right.
And sometimes not saying anything is all they need. They just need you to be there. I think it's also good to recognize that, yes, we work on an oncology floor, but it's not just people getting chemo. We get hospice all the time, too.
Yeah.
So when that happens, focusing like, okay, this family's about to lose their loved one. What can you do to try to make them feel better? And then it does feel good, because sometimes the patient's family members will recognize you for that. But yeah.
So that is things that you said, and there's so many, like, this is so rewarding,
It is.
because some of the patients don't have families. Some of them don't have kids.
Right.
And we are the one that they have.
Right.
So caring for someone who basically doesn't have anybody, I think that's what makes nursing and our job as oncology nurses so rewarding.
It is.
And you mentioned hospice. Oh my gosh, this is tough. How do you caring for somebody who you've been treating from diagnosis, treatment, and then now, unfortunately, that person doesn't do well. Now the physicians are recommending hospice. This is so so tough.
It's hard. I think I've seen like different scenarios. Like one, like like they accept it, and then they go, or like there's some people still in denial, which that's just part of like the grief cycle too. Because even if they haven't passed away, there's still a grief cycle for that. But yeah, no, it's just so difficult. There's no words for it. It sucks. It's just like a matter of like, okay, how can I try to make a difference, make it easier for them? Sometimes just giving them some time, but they're angry and sometimes they'll be angry towards you because they're trying to release their anger, and you have to learn like you can't take that personally either.
Yeah, that's right.
Because you'll learn too, there's some nurses that can't handle that, and that's okay. But that's just, that's not your line of work. Yeah. If you can't handle oncology, you have to have those skill sets and a lot of self-care when you're in this field. Yeah.
Has ever patient changed the way you see your own life as an oncology nurse? Has ever like changed, taking care of a patient? Has it, ever changed the way you see your own life?
Yeah, I was always this person like, oh, I need to do this, I need to do that. Like, it's more like I need to take a step back and then actually look at being grateful and honestly be grateful that I see another day, because some people don't. And honestly, just focusing on really making memories of what's important to me, like being with my husband, family, and like, what do I want to do before, like for myself, what do I want before I leave this earth? Because we all are going to pass away at some point. It's just we don't know when. So focusing on what's more important, what you want to do, and don't be afraid to do anything, honestly, if you have any goals.
Yeah, that is huge. Now, what do you think people should know about oncology nurses? And I mean, I know if somebody watching this podcast, and if whether they're a nurse or somebody who's thinking about becoming a nurse, what is it that you want them to understand or they wish to know about nursing, oncology nurses? Like, we talk about everything from nursing school to becoming an oncology nurse. And I think one thing that I can say, I don't want to say misunderstand. And in our unit, I think people might say, oh, this is a very nice floor. And when they start taking care of anybody who float from another unit coming to another floor, and they were like, oh my gosh, this is so nice. This is this. But when they start hitting the floor and start taking care of patients, they were like, oh, this is so hard. Like, people, I want people to understand that. Like, when you're taking care of patients, oncology patients, it's a lot. So I want people to understand. So on your own words, when people say, you know what, oh, you guys have one tech, you guys should be fine.
Yeah. I'm sorry. I'm just like, oh, the one tech. It's what they look at is, okay, this is considered med surge, but yeah, it's med surge oncology, but these patients are more than just that. They are specialized, they're complex. They require a lot more than just med surge treatment, meaning there's palliative involved, meaning like pain control. And I know if we get nurses from other units, sometimes they're like, oh my gosh, they get this for pain? I'm like, well, you got to look at their cancer diagnosis. If they have bone mets, that's very painful. Yeah. They build a tolerance over time, so they have to increase the dose. I've seen nurses so uncomfortable pushing that, and we're like, oh no, they need this for pain control. Um, but yeah, I think you have to understand these oncology patients, they're very complex. Their diagnosis is complex, and they can change anytime. Whether like if they have a tumor that's growing in their chest, you gotta watch like, is it compressing on their like vena cava? Like, you know what I mean? Like on their heart, like you have to be aware what their cancer is and what could happen if they start to decline. But yeah, they're in all is just, you have to, oncology just is more than what people realize. And it takes a lot of skills to be compassionate, empathy, and honestly, just have, what's the word I'm looking for? Sorry, I'm like, I feel like I know what I want to say. You have to just take your time with them.
Yeah. Holding their hands. Something as...
Because sometimes they find out with you, oh, my cancer just spread to my brain. Now I don't have a good diagnosis. And they're crying. What are you going to do for the patient? You're going to be there for them.
So what's next for you in terms of your career?
That's to do. Sorry, I'm just laughing because I know we've had this conversation before. So I'm still trying to figure out exactly what I want to go. I'm meaning like I already have my BSN. I've had people ask if I want to do my master's, but I don't know if I want to be a nurse practitioner because I do like being at the bedside. I've actually had some people tell me, "Oh, you would be a good A&M." I was
That's true.
But I'm not thinking about that because me personally, I'm not saying I wouldn't, but I want more experience before I do that. I feel like that would be better for me just because, like I said, I've been working for almost 2 years and it makes you feel good. People think that would be a good role for you. Maybe down the line I would consider that, but for now I just want to get some more experience and then I'll think about, is that something I really want to do?
Okay, I mean, I think that's fair because you still have the time to figure out things and see exactly where you want to go, whether oncology is a place for you, whether you want to, try leadership, because I think that you have all the qualities to do leadership. For me, personally, I've been a charge nurse and I've always, not always, but I think I was reluctant to step into that role. Because this is a management position, right? Where you have to be the resources, you have to be resourceful, your nurses come to you for help.
Right.
And I always, you know what? I don't want to be into management. But I tell you, when I became a charge nurse, it was the best decision that I've made. Because what made it so special for me to be as a charge nurse, because I feel like I am the person that the nurses are calling if they need something or if they need help. And I want to be that person to be like, if they're trying to get an IV, they can't get it. Or they've tried, a few times, they can't get it. I want to be that person, right? And in any codes, I want to be in there. I want to be basically helping my patients and everything. So I think I grew a lot in that role. And I'm always pushing. I'm always pushing people. Great nurses to go into leadership. Because if you want to make a change, it has to be at the leadership level. Because there's a lot of things in nursing that in our day-to-day, we want things to change. But the only way to change it, in my opinion, is to step into leadership role. Because you want to be in that room when the decisions are being made.
Right.
So that's why I'm like, great nurses go into leadership roles.
And it's not that I don't, it's just me personally, I want some more time at the bedside, gain more experience. So if I go later down the road in that leadership role, I'm more there for the people. Because, you can see I'm younger. that's something like as
That's the
younger
best time to
nurses.
do it. Go into leadership as you're young.
But I'm saying as like they're older nurses
Yes.
that may see me if I'm like in a leadership role, or even like with techs. If I have a tech that's older than me, like sometimes we have to talk to each other because sometimes even delegating when they know I'm younger
Yeah.
can be a little tricky.
True.
So you have to. We've had this conversation. You got to develop those boundaries.
Yes. Boundaries.
Yes. But in a respectful way.
Yeah.
But no, I am thinking about it. It's just for me, I want more time bedside, and then I have thought about it.
Anything that you want to say before we wrap up
About nursing?
about your experience? Anything else we didn't touch on? And anybody who's watching, anything that you wanted to, is anything else you wanted to add?
I think we hit everything. I think I would just repeat, like, if you're in nursing school, give yourself more grace. Take time, use your resources, and yeah, I think we hit about everything.
So this is one thing that I think those podcasts that we are doing, those anything that we're putting out there is to educate and elevate those new nurses. Sometimes it is so scary a career after to nursing school, and you got a job and you get orientation or whatever. I don't know what 6 weeks. I don't know how long it was as a new nurse, and then now you're on your own. Anything that we're putting out, I think that whatever we can do to help those new nurses, ask any questions. I've heard nurses say, "Oh, this is a stupid question." No question is
Scary.
I think the worst you could do is not ask it.
Right.
And then you're saying, make an error. So it's just whatever we are doing is to motivate nurses, new nurses, and any techs who has an idea. Okay, I want to become nurse. I'm a nurse as well. Who has the doubt? If somebody has a doubt right now, I'm not quite sure if I should be a nurse, but they know that they want to be, and they have the ability. How do you speak to that one person right now who wants to be a nurse but have that doubt that whether they can do it or not?
You want my answer?
Yes.
You only live once. Go for it. Honestly, because you won't know unless you try.
Yeah.
You have to take that risk even though you're scared, you need to do it. You need to take the risk, because if you don't, then you're going to always wonder, or even like, I should have.
Yeah.
So if you never do, then you won't ever find out.
Yeah. Well, go do it. Go do that. If you have if you have the idea and you have that in your mind, you wanted to be a nurse, go do it. You hear from Riley, go do it. You only live
You
once.
can do it.
So thank you so much, Riley, for trusting me with your story. Thank you for taking the time today and to be in our podcast. And that was a lot of fun.
It was.
And for those of you who are watching, share, comment, let us know what you're most in your career. How did you start? And we would love to have the conversation. What is it that you would like to see change in the nursing career? And because we want to see new nurses be able to practice wherever you are, to be able to practice, say, I'm so proud to be a nurse because this is the most trusted profession. I take so much pride of that.
Yes.
Because if you are a CNA or whatever and you want to be a nurse or you want to change a career, I never regretted that I chose to be a nurse because this is so rewarding. So thank you once again. This seat, it's yours. You can come out anytime.
Okay.
Thank you.
Thank you.